Hi, I'm Jacqueline Lerma, and today we will be discussing a skill acquisition program protocol for my specific client. We're going to be using prompting hierarchy for requesting items using FCT with the use of PEX or an iPad app, right? So prompt hierarchy is when we are teaching learners the correct response. We prompt before the error occurs. We also want to teach them the correct way from the very start, especially if it is a novel skill that they're learning. So when it's a situation of such, we use what is called most to least prompting. And that is going to be called the most intrusive piece of prompting hierarchy. The less intrusive piece of prompting hierarchy is called least to most, and that typically is used when there is a skill already built in their repertoire, or they have some form of knowledge of what the skill is. So they have some sort of skill acquisition of the skill. However, it's not really completely done independently. So in this case, I'm going to be using the least to most prompting just because, again, my client has some form of skill acquisition and he is moving through it with grace, and he's requesting things, he's reducing that biting. So let's move forward. We will be using PEX, our functional arbitrary exchange system. We'll be using our iPad communication app that was placed by his speech therapist, and then also our reinforcers are very important in this piece. His reinforcers are farm animals, a barn. He loves anything having to do with farm animals. He enjoys being on the floor and just playing with them. So we will use that reinforcer to hopefully have that repetition of the target behavior that we're wanting, right? Use communication rather than biting. So the initial SD delivery is, the SD is your discriminative stimulus. What's the instruction, right? That's what it is. Your SD is going to be the instruction that you are providing to the client. For example, what do you want? You observe the client's response. If it's appropriate, awesome, you provide that reinforcer immediately. If it is not appropriate, then we will correct the response using the least intrusive prompting necessary to guide the client to the correct response. If it means that we need to use partial physical, then we will provide partial physical. Maybe, guide his elbow to the iPad. Not that it's necessarily at the full yet, right? Which is hand over hand. To get a little bit of an insight of what the prompting hierarchy looks like, you're gonna have your full physical, your partial physical, your gesture, your modeling, and then your independent. So that's going to be the first attempt, right? Let's start. We don't have to necessarily start at the most intrusive, right? Or we could even start at the gestural. We can point to the correct response. Restate the SD and immediately follow with the prompt. What do you want? And gesture it, right? You're going to point to that card or that picture. The second attempt is restate the SD again, this time using a less intrusive. So maybe we're not using the partial physical. We're using a gesture, or we're using a modeling. It's all dependent on the situation, of course. The third attempt, we can run 1 to 2 distractor trials, and they're going to be easy trials. You can say, things that he already knows. What is cat or show me the picture of a cat, show me a picture of water, show me a picture of I don't know, of the farm, right? So he's going to choose from those three, and he'll get, because those are already in, he knows those items. And then you're going to go back and reinstate that SD, the instruction. Look for that independent response. He obtains it, and you provide that reinforcer. It can be, it's also good. I always like to use verbal praise and then give them the tangible reinforcer, just because it's so much more profound. And they really enjoy your facial expressions, your excitement, your bravos, in addition to the tangible item of the reinforcer, which is going to be his farm animals. So the prompting hierarchy, like I said, it's going to be gesture, partial to full physical. Use Apex consistently for requesting items to reinforce the use of appropriate communication methods. So that way we can have that reduction of biting, right? Because it's attention, there's something that he is wanting. And so instead of biting to get our attention, we're going to use FCT. However, we're prompting him to a certain extent. So we're going to use gesture prompting. It's going to be our step number 1. Staff points to the PEX or the iPad, and the client the client is using. Restate that SD while pointing to that card or to the button. Let's say, for example, he is wanting to go to the restroom, right? So there's a picture of a toilet and there's a picture of a toy. So you're going to point to the toy. I apologize, to the toilet. So that way we know what he wants. So we're going to go ahead and proceed and go into the restroom. But before we go to the restroom, we provide that reinforcement. Parts of physical prompting. The staff guides the client's hands towards the pecs. So if he is unable to obtain that response independently without the gesture, we're going to move up, right? So we're going to probably push his elbow just to the iPad. We could move his arm closer to the iPad or to the picture that's on the iPad, or to the card as well. We're going to restate the SD, what do you want, while guiding the client's hand. Full prompt physical, the staff fully assists the client in selecting the PEC card or pressing that iPad button. So what can happen here is hand over hand assistance, right? We can get his hand and we're going to place it right at that picture card that we are needing for him to choose. So at that time, we're already at the most intrusive piece of the hierarchy, right? However, we started from the least to most, and we move up the ladder in the event that he does not obtain that full correct response. A couple of more tips is ensure that the environment is conducive to the learning environment with minimal distractions. We don't want to have other reinforcers around in the table that can cause a distraction and can impede that correct response from the client. Always use highly preferred reinforcers. This is going to be the motivator. This is going to motivate the client to that correct response as well. Children often always will work for their preferred items. So that is going to be a farm, animals, cars, even an edible item. Please give him those items. Also, I see this often, maintain a calm and patient demeanor. It can get frustrating as a therapist or as a practitioner, knowing that they know the answer, however, they're unable to respond to the correct response or provide that correct response. So always providing the calm demeanor, because children will pick up what you are feeling. Doesn't matter if there's a disability in place or not. So always keep in mind to be as patient as possible and wait for that response for them. Give them a couple of seconds and they will respond. If they need that prompting, go ahead and provide the prompting for them. so they can have a positive learning experience. Thank you. Bye-bye.